evening. My name is Zaina. I am a student at GW in the nurse practitioner program. I will be doing a general wellness exam on you today. My patient is Mr. S. He is a 30-year-old gentleman. He appears to be well dressed, in good hygiene. Throughout this exam, I will be assessing his mood and affect, as well as his facial symmetry, or note any slurring in his speech or asymmetry in his movements at all. All right, first off, my hands were washed prior to this. We are going to assess your head. Have you had any recent trauma?
No.
All right, no trauma noted to the head. And then the scalp, everything looks clear. I'm also taking a look at his skin color. It's pink within appropriate for his ethnicity. No edema noted. I'm looking at his nails. No clubbing noted. Capillary refill is less than 3 seconds. Looks great. Checking your radial pulse. Also, if you could squeeze my hands. Excellent. Equal strength in both hands. All right, next I'm going to be taking a look at your eyes. There's no drooping of the eyelids. I'm also going to pull down, look at your sclera. Looks good. Would you look to the other side for me? Excellent. All right, I'm also going to check your face for tenderness. Do you have any tenderness?
No.
Okay, and then next I'm also going to be palpating for your lymph nodes. Okay. No abnormalities noted. After that, I am going to also palpate your temporal arteries. Okay, they are palpable. And also I'm going to have you clench down your jaw. Excellent. And then open and close your jaw for me. Awesome. No popping noted. I'm now going to listen to your temporal arteries with the bell of my stethoscope. Excellent. All right, now I'm going to be checking your visual acuity. Prior to this video, we have measured 6 feet from the location of the patient. I'm going to have you start at the top. Can you, with both of your eyes, read that top line for me?
E.
After that?
LT.
Next?
FPH.
Next?
OLCF.
After that?
DHJS. FS.
Next?
ZFTZG or O.
Okay. After that?
Too small. ZFTPJ.
All right, so that's 20, 30 in both eyes. I'm going to have you cover your right eye for me. And then start from the top.
ELT.
Keep going.
FPH.
Next.
OLGF.
After that.
SHJ. FS.
Can you try the next line?
No. Too blurry.
Okay, so your left eye is 20/40. Now cover your left eye for me and use your right. Can you start at the top?
E.
Next.
LT.
Next.
FPH.
Okay.
OLCF.
Next.
DHJ. BS.
Okay. Next.
EFTZO.
All right, so your right eye is 20/30. Okay. Now we will dim the light. All right. I'm going to check for pupillary reaction. They are equal and reactive. And now I'm going to be checking the back of your eye. All right. you to follow this pen. We're checking for any extraocular movements. Alright, no extraocular movements noted. Alright, I'm also going to check your peripheral vision. So you're just going to tell me when you see my 2 fingers moving.
No.
Okay?
No.
Okay, excellent. Alright. Next, we're going to take a look at your ears and nose. I'm going to be looking up just to check for any septal deviation. The light is on. Okay, excellent. I'm going to take a look at your no bulging noted. Alright, no drainage or bulging noted in there either. Alright, next I'm going to be checking for air and bone conduction. I'm going to be tuning this fork and then placing it on the top of your head as well as behind your ear. Alright? Do you hear anything?
Mm-hmm.
What do you hear?
A vibration.
Okay. And then we're going to also check it.
Yeah, it's louder and I like to feel it.
Okay. Let me check it. Same on both sides?
Mm-hmm.
Okay.
Yes.
Alright. I'm also going to have you smell some incense for me. I'm going to have you close each nostril and you can tell me if you smell it more in one than the other.
Same.
What do you smell?
Incense.
Okay. Alright. Okay, I'm next going to test for your hearing acuity. I'm going to be whispering something in your ear while rubbing 2 fingers in the other, and if you could repeat what I say into your ear for me, okay?
99. 99.
Okay, thank you. Alright, next we're going to be checking for any loss of sensation in your face. I'm going to be touching you with this cotton swab, and you let me know if you do feel it, and if you feel it more on one side of your face than the other. Tell me if you feel it.
I do. I do. Feel. Feel it. Feel it.
Okay. And then now I have to check your corneal reflex. So I will be lightly wisping this on your eye. Okay. Look like over my shoulder.
Okay.
Alright. Okay, sorry about that. Next, I'm going to be checking the inside of your mouth. As I'm looking at you, I'm checking your lips are moist. I don't notice any dried or cracked lips. Like I said earlier, I washed my hands, placing my gloves on. Alright. I'm going to have you open your mouth for me and say ah. No, stick your tongue out. Stick your tongue out. Okay. The tonsils are not swollen. Pink. No bleeding gums noted. No ulcerations. Stick your tongue out again. The palate is pink and moist. Thank you. Alright. Next I'm going to have you turn around for me. Oops. I'm going to have you, let me take these off. Shrug your shoulders against me pushing down. Alright. Equal strength bilaterally. Turn around. And it is symmetrical. Alright. Next, we're going to be inspecting your chest, heart, and lungs.
Mm-hmm.
So if I can have you remove your shirt for me. Okay. I'm going to have you turn around. so that I can check the symmetry of the expansion of your chest. So if you could please take in a deep breath for me and exhale. Excellent. Chest movement is symmetrical. Next, I'm going to be palpating for any abnormalities in your rib cage. I'm gonna have you turn around for me again. At this time, I'm looking at your anterior posterior diameter, no barrel chest noted. And we're also checking here your ribs, no protrusions or abnormalities noted. I'm also going to be percussing just to listen for your aeration. Okay, and turn around and do that as well on your back. Excellent. I'm now going to be checking for your diaphragmatic excursion. So we'll see here. Excellent. Okay. Next, I'm going to be listening to your lungs. I ask as I do this that you take in deep breaths in and out of your nose, but with your mouth open.
Okay.
I'm listening to the diaphragm. Okay, go ahead, start. Alright, lungs are clear posteriorly, no adventitious breath sounds noted. And we'll also do the same thing on your front. Go ahead, take a deep breath. Excellent. Alright, at this time I'm also going to begin my cardiac assessment of your chest. I'm currently looking for any heaves or lifts, and I don't see any noted. I am going to be touching your chest as well to check for any lifts. Alright, no lifts noted. I'm also, throughout the assessment, taking a look to make sure that I don't see any JVD, and none is noted. I am going to begin my cardiac assessment in the upright position, and then I will have you lay supine for me.
Okay.
Alright. Can you lean forward for me a little bit? No, not with your head, but like sort of with your body. There we go. Okay, excellent. Alright, and then I'm gonna have you go ahead and lay down for me. Okay. Now I'm gonna have you lay on your left hand side with your arm sort of like above your, yep, just like that. Before I listen to how it sounds in this position, I'm going to also assess for your apical pulse. Okay, it is right there. Excellent. Okay, thank you very much. You can go ahead and sit on up and put your shirt back on. And that concludes my assessment. Thank you very much for watching.